Welcome back to Medic Talk. Today, we're going deep into COPD.
Chronic Obstructive Pulmonary Disease.
Yeah, COPD. It's unfortunately pretty common.
Mm-hmm.
We're going to break down everything you need for that next exam
Okay.
or clinical rotation,
Right.
from the types of COPD
Yeah.
to the causes
Uh-huh.
to the symptoms
Okay.
and how it's diagnosed.
Sounds like a plan.
Ah.
And it's also tricky.
Yeah.
Even with all the advances in medicine,
Yeah.
we still don't have a cure for COPD.
Right.
It's all about management and
Yeah.
slowing the progression.
Exactly. Which is why understanding it inside and out
Yes.
is so important for us future healthcare heroes.
Absolutely.
Okay, so first things first, beyond the textbook definition,
Okay.
what does COPD really mean for a patient?
Think of it like this.
Okay.
COPD is an umbrella term
Right.
that covers a couple of major lung conditions,
Okay.
emphysema,
Mm-hmm.
and chronic bronchitis. It's like having a 2-for-1 deal, but not the good kind.
Oh, I get it. They often show up together,
Mm-hmm.
but aren't they different conditions?
Right.
What distinguishes one from the other?
You're right. They are distinct.
Okay.
Imagine the lungs
Ah.
as a complex network of pipes
Okay.
and tiny balloons.
Yeah.
The alveoli,
Uh-huh.
with emphysema,
Oh.
those balloons lose their elasticity
Right.
and basically can't do their job of gas exchange anymore.
Hmm.
The main symptom is shortness of breath.
Okay.
Like you're constantly gasping for air.
And chronic bronchitis?
Yeah.
Is that the one with all that mucus?
Mm?
I remember learning about excessive mucus production,
Right.
making patients cough constantly.
Exactly. It's all about inflammation.
Okay.
The airways get irritated, and the body produces tons of mucus
Mm-hmm.
in an attempt to protect itself.
Right.
But all that mucus just clogs things up even more,
Yeah.
makes it hard to breathe,
Right.
and causes that persistent cough.
So someone with COPD
Mm-hmm.
could be dealing with a double whammy.
Unfortunately, yeah.
Shortness of breath from emphysema
Yeah.
and the miserable cough from chronic bronchitis.
Many patients experience features of both conditions.
Wow.
Which is why understanding the distinct mechanisms of each
Yeah.
is key to providing effective care.
Okay, that makes sense.
Yeah.
So let's talk about what causes this dynamic duo
Okay.
to develop in the first place.
Right.
Everyone knows smoking is a major culprit,
It is.
but how does it actually wreak havoc on the lungs?
Smoking is like a slow-burning fire,
All right.
constantly damaging the delicate tissues of the lungs. It triggers chronic inflammation,
Right.
destroys those tiny hairs,
Yeah.
the cilia that normally clear out mucus,
Right.
and literally breaks down the air sacs.
Wow.
It's like setting off a chain reaction of destruction.
So I read some studies about third-hand smoke,
Oh, yeah.
that residue that clings to clothes and furniture. Is that something to worry about with COPD patients?
That's a great question.
Or is it mainly about direct and secondhand smoke?
And you're right to be thinking about it.
Huh?
While research on third-hand smoke is still ongoing,
Right.
there's growing evidence
Okay.
that it can exacerbate COPD symptoms.
Yeah.
So minimizing exposure to any form of smoke
Yeah.
is
It's-
crucial.
So it's not just about quitting,
Right.
but also about creating a smoke-free environment
Yes.
for patients.
Exactly.
Got it.
Yeah.
Now, beyond smoking,
Mm-hmm.
are there other risk factors
Absolutely.
that can contribute to COPD?
Think about long-term exposure to air pollution.
Okay.
Those tiny particles can get lodged deep in the lungs
Right.
and cause damage over time.
Yeah.
Certain occupations
Yeah.
also put people at risk,
Makes sense.
like coal miners
Right.
or construction workers exposed to dust and fumes.
Right. It makes sense that constant exposure to irritants
Yeah.
could take a toll.
Mm-hmm.
Is there anything else? What about genetics? Can those play a role?
Definitely.
Okay.
There's a genetic condition called alpha-1 antitrypsin deficiency.
Okay.
Basically, it's like the lung's bodyguard is missing in action, leaving them vulnerable to damage
Right.
from all those environmental factors we just discussed.
So even without smoking,
Mm-hmm.
someone could be predisposed to COPD.
It does.
That really highlights the complexity of this disease.
Yes, doesn't it? And it underscores the importance of taking a thorough medical history
Right.
to understand each patient's individual risk factors
Yeah.
and tailor treatment accordingly.
Speaking of challenges,
Yeah.
let's delve into the common symptoms
Okay.
you might encounter
Okay.
with COPD patients.
Sure.
What should we be on the lookout for?
Well, that persistent cough we talked about earlier
Okay.
is a big one.
Right.
It's not just a tickle in the throat. We're talking about a cough that produces phlegm, and has been bothering the patient for months, even years.
Yeah.
Imagine trying to go about your day
Yeah.
with a cough like that.
That does sound pretty miserable.
It is.
I can imagine it would wear anyone down.
Yeah.
What about breathing difficulties?
Shortness of breath is another hallmark.
Okay.
And it can be really debilitating.
Yeah.
Everyday activities
Right.
like climbing stairs or walking to the mailbox can become huge challenges. It's like breathing through a straw, as you mentioned earlier.
Okay, so persistent cough and shortness of breath. Those are the biggies.
Those are the big ones.
Are there any other signs we should be aware of?
Keep an ear out for wheezing.
Okay.
That whistling sound when someone breathes. It's a sign of constricted airways, struggling to let air in and out.
Right.
And as COPD progresses, you might even notice physical changes in the chest.
Physical changes, what do you mean?
The lungs can become chronically overinflated with air, leading to a barrel-shaped chest.
Wow.
It's a visual indicator of how much the disease is impacting their respiratory system.
So COPD can actually reshape the body. That's pretty striking.
It is.
Now, this might sound like a strange question.
Okay.
But I remember reading about bluish skin being a symptom.
Right.
How does that happen?
It might sound strange, but it's a crucial sign.
Okay.
That bluish discoloration called cyanosis happens when the blood isn't carrying enough oxygen.
Right.
Remember, COPD makes it hard for the lungs to do their job.
Yeah.
And that affects the entire body's oxygen supply.
So it's a sign that things are getting serious, right?
Exactly.
Like the body's really struggling to get the oxygen it needs.
Cyanosis is a major red flag that requires immediate attention.
Wow.
It's a sign that the body is in distress.
Yeah.
And needs help fast.
So we've got the cough, shortness of breath, wheezing barrel chest, and cyanosis. Those are some pretty significant symptoms.
They are.
And I bet there are potential complications too, right?
Unfortunately, yes.
Like what?
Think about it. The lungs are already compromised,
Yeah.
making them an easy target for infections.
Makes sense.
Pneumonia is a common complication.
Right.
And it can be especially dangerous for someone with COPD.
Are there other serious complications we need to be aware of?
Oh, absolutely.
I mean, it's not just about the lungs.
You're absolutely right.
This can affect the whole body.
COPD can have a domino effect.
Okay.
When gas exchange is impaired, it leads to problems like hypercapnia, high carbon dioxide levels, and hypoxemia, low oxygen levels. These can be life-threatening.
Wow, okay.
Yeah.
So we're talking about respiratory failure.
Yes.
Maybe even heart problems.
Exactly. Pulmonary hypertension.
Okay.
Even right-sided heart failure, which is called cor pulmonale.
Right.
And it doesn't stop there.
Collapsed lung.
Yeah.
Or pneumothorax. And polycythemia.
Okay.
Where the blood thickens.
Right.
Making it harder for the heart to pump.
Wow.
It's a whole cascade of potential issues.
It's clear that COPD is much more than just a smoker's cough. It's a complex systemic disease.
It is.
With potentially serious consequences.
Absolutely.
That's why getting a handle on diagnosis is so important.
You got it.
Yeah.
Early and accurate diagnosis is essential.
Okay.
It all starts with a detailed medical history.
Right.
Asking about smoking history.
Yeah.
Exposure to pollutants at work or in their environment.
Right.
Family history. And those specific symptoms they've been experiencing.
Okay.
That's crucial.
So it's like detective work.
It is.
Piecing together clues.
Yeah.
To get a clear picture.
Exactly.
And then we bring in the tests. Right. Okay.
Pulmonary function tests. Or PFTs.
Right.
Particularly spirometry.
Yeah.
Are key for measuring how well the lungs are working.
I remember learning about spirometry.
Okay.
But remind me.
Yeah.
What exactly is it measuring?
It's a simple breathing test.
Okay.
That measures how much air someone can inhale and exhale.
Right.
And how quickly they can do it.
Okay.
One of the key measurements is the FEV1.
Right.
Or forced expiratory volume in 1 second.
So FEV1 tells us how much air they can force out in 1 second. The lower the FEV1, the more severe the COPD, right?
Exactly. It helps us gauge the severity of airflow obstruction, which is the hallmark of COPD.
What about other tests?
Sure.
Do we use imaging?
Absolutely.
Like X-rays or CT scans?
Those help us visualize the lungs and rule out other conditions
that
might be mimicking COPD.
Yeah.
We can actually see the damage, the overinflation, and any other structural abnormalities.
And what about blood tests?
Yeah.
Do they play a role in diagnosing COPD?
Yes, they can. How so?
An arterial blood gas test helps us get a precise measurement of oxygen and carbon dioxide levels in the blood. And remember that alpha-1 antitrypsin deficiency we talked about earlier?
Yeah.
To test for that, too.
So it's a multi-pronged approach.
Precisely.
Combining patient history, lung function tests, imaging, and blood work.
Right.
A real holistic view of the situation.
And once we have all the pieces of the puzzle, we can move on to the next crucial step. Staging the COPD.
Right. I know there are different stages of COPD, but I always get a little confused about how they're determined.
Of course.
Can you break that down for me?
Remember that FEV1 value we talked about?
Yeah.
That plays a big role in staging. It ranges from stage 1, which is mild, all the way to stage 4, which is very severe.
So the lower the FEV1, the more advanced the COPD. But I've also heard about letters being used in staging.
Good catch.
What's that all about?
Doctors also consider the patient's symptoms and their risk of experiencing those sudden worsenings called exacerbations. We use letters A, B, and E to categorize those aspects. It helps us paint a more complete picture of how the disease is impacting the patient.
So someone could be in a later stage. Based on their FEV1. But they might still have fairly mild symptoms.
Exactly. It's not always a one-to-one correlation.
Wow.
Someone in stage 3 could have mild symptoms and be categorized as group A, while someone in stage 2 might have more severe symptoms and fall into group B or E. It's all about individualizing the assessment.
This is already so helpful. It's amazing how much depth there is to COPD.
It is.
We've covered the different types, the causes, those telltale symptoms, and potential complications, and even the staging process. It's like we've gone from zero to hero on COPD diagnosis.
I'd say we're well on our way, but the journey doesn't end there. Understanding how to manage and treat this complex condition is the next critical step.
Welcome back to Medic Talk. In part 1, we tackled COPD diagnosis. Uncovering the different types, the causes, and those telltale signs that can help us catch it early. Now the million-dollar question. How do we help our patients manage this complex condition?
Yes, the management maze.
Yeah.
It's true that COPD can feel like a puzzle. Especially since we can't just magically reverse the damage. But don't worry, we've got a whole arsenal of tools to help patients breathe easier and live better.
That's reassuring. I know quitting smoking is always at the top of the list.
It is.
But is it really that impactful, even if the damage is already done?
Absolutely.
Really?
You're never too late to reap the benefits of quitting. It's like hitting the brakes on that runaway train of lung damage. We see reduced inflammation, slower decline in lung function, and a lower risk of those scary complications we talked about.
So it's a must-have conversation.
It is.
With every COPD patient.
Yes.
No matter what.
Every single one.
Got it. Now, what about medications?
What
are the go-to drugs for managing COPD symptoms?
Think of it like a two-pronged approach. We've got bronchodilators to open up those airways and corticosteroids to tackle the inflammation.
Could you break down how those work?
Sure.
I always mix them up.
Imagine bronchodilators as those little air pumps you use to inflate a pool float. They relax the muscles around the airways, letting air flow more freely. Corticosteroids, on the other hand, are like firefighters putting out the flames of inflammation, reducing swelling and irritation.
That makes so much more sense.
Good.
And how are these medications usually given? Are we talking inhalers?
Inhalers are the most common, delivering medication directly to the lungs for quick relief.
Pills, Fiji drips.
We also have nebulizers, which turn the medication into a fine mist. That's easier for some patients to inhale.
Makes sense.
And of course, in some cases, we might use oral medications or even IV steroids, especially during those acute flare-ups.
It's great that we have so many options.
It is.
To customize treatment.
Yes.
Based on the patient's needs.
Absolutely.
Now, I remember reading about oxygen therapy. Is that something we use routinely for COPD?
Well, oxygen therapy is like a lifeline for patients with chronically low blood oxygen levels.
Okay.
Remember hypoxemia?
Yeah.
It helps improve their oxygen saturation. It makes breathing less of a struggle.
Or is it reserved for specific situations? So it's about giving those lungs a little extra support.
Exactly.
Now let's switch gears and talk about non-medication approaches.
All right.
I've heard great things about pulmonary rehabilitation.
Yes.
But what exactly does that entail?
It's like boot camp for the lungs.
Oh, wow.
But don't worry, it's not as intense as it sounds.
Okay.
It's a structured program combining exercise, education, and support to help patients breathe better, conserve energy, and improve their overall quality of life.
So it's a holistic approach, not just focusing on the physical aspects of breathing.
Right.
What are some of the key components?
Think tailored exercise routines to strengthen respiratory muscles, breathing techniques to improve efficiency, and energy conservation strategies for everyday activities.
Right.
Plus, there's a huge emphasis on education and emotional support. We help patients understand their condition, manage their medications, and cope with the psychological impact of living with COPD.
It sounds like a game changer for patients.
It can be.
Now, are there any other interventions we might consider, especially for those with more severe COPD?
In some cases, we might explore surgical options, like lung volume reduction surgery or LVRS.
Right.
It's a bit like pruning a tree.
Okay.
We remove damaged lung tissue to give the healthier parts more room to expand.
That's fascinating.
Yeah.
Are there any less invasive procedures available?
There are.
Oh, really?
We also have a newer procedure that involves placing tiny valves in the airways to redirect airflow away from the damaged areas.
Okay.
It's less invasive than LVRS. And can be a good alternative for some patients.
Or is surgery the only option in severe cases?
Right.
It's incredible how much progress has been made in COPD treatment.
It is.
So we've got a whole spectrum of options.
Oh, you do.
From lifestyle modifications.
Right, medications to advanced procedures.
Right.
But what about preventing COPD in the first place?
Well,
is there anything we can do?
Well, the best offense is a good defense, right?
Yeah.
And as we've already discussed, the biggest weapon in our arsenal is smoking cessation.
Right.
Preventing initiation and promoting quitting is paramount.
Totally agree.
Yes.
But what about those who are already exposed to pollutants or occupational hazards?
Sure.
Is there anything they can do to minimize their risk?
Absolutely.
Like what?
Protective gear, like masks, can be lifesavers in those situations. Making sure workplaces have proper ventilation.
Right.
And being aware of air quality reports.
Yeah.
Can also make a big difference.
So it's about being proactive and taking steps to protect those lungs.
It is.
Are there any other preventative measures we should be emphasizing?
Vaccinations are crucial.
Oh, right.
Think flu shots, pneumococcal pneumonia vaccine.
Right. And of course, the COVID-19 vaccine.
Yeah.
These help protect against respiratory infections.
Right.
That can be especially dangerous for someone with COPD.
That makes perfect sense.
Yeah.
Those infections can really knock someone down.
They can.
Especially when their lungs are already compromised.
Absolutely.
Now, for those already living with COPD, what are some tips for managing the condition day to day?
Think about it like a detective game.
Cool.
Identifying and avoiding those pesky triggers that worsen symptoms is key.
Could you give some examples of common triggers?
Smoke is public enemy number one, of course.
Right.
But we've also got air pollution, dust, pollen, even strong perfumes or cleaning products. It's all about understanding what sets off their symptoms and taking steps to minimize exposure.
So it's about personalized detective work.
Exactly.
And I imagine sticking with that pulmonary rehab routine is important too, right?
Those exercises, breathing techniques, and energy conservation strategies should become a part of their daily routine. It's about building healthy habits that support their lungs.
What about diet?
Oh, yeah.
Does that play a role in managing COPD?
Definitely. A balanced diet, rich in fruits, vegetables, and lean protein can boost their overall health and immune system.
Makes sense.
And working with a registered dietitian can help tailor their diet to their specific needs.
So it's about nourishing the body from the inside out.
It is.
What other aspects of daily life should patients be mindful of?
Medication adherence is crucial. Taking those meds as prescribed and having refills ready can prevent those sudden flare-ups and keep symptoms under control.
It's easy to get busy and forget about refills.
It is.
So that's a great reminder.
Yeah.
What about those flare-ups? Is there anything patients can do to be prepared?
Having a flare-up plan is essential. It's like a roadmap for what to do when symptoms suddenly worsen. Knowing those warning signs, when to call the doctor, and having emergency contacts handy can make all the difference.
So it's about empowering them to take charge of their health.
Exactly.
And be prepared for any situation.
And let's not forget about those medical devices. Oh, right. Inhalers, nebulizers, oxygen tanks.
Right.
Knowing how to use them correctly is crucial for getting the full benefit of treatment.
It's like learning a new skill.
It is.
And speaking of learning, I imagine living with a chronic condition like COPD can be tough emotionally. How can we support our patients on that front?
You've hit the nail on the head.
Yeah.
COPD can take a toll on mental health.
Right.
Encouraging open communication. Connecting them with support groups. And even referring them to mental health professionals can provide invaluable support.
It's about recognizing that their emotional well-being is just as important as their physical health.
We need to treat the whole person, not just the disease.
And, sometimes just listening and validating their feelings can make a huge difference.
Absolutely.
It's about building that trust and letting them know they're not alone in this journey.
Exactly.
Now let's shift gears and talk about when it's time to raise the red flag and get the doctor involved. Obviously, anyone who suspects they might have COPD should seek medical attention immediately.
Absolutely. Early diagnosis is key.
Absolutely. But for those already managing their COPD, when should they be reaching out to their healthcare provider?
Any noticeable worsening of symptoms is a signal to get in touch. Increased shortness of breath, changes in mucus, more frequent coughing or wheezing. Those are all red flags.
So it's about paying attention to their bodies. And any shifts from their baseline.
And don't hesitate to contact the doctor if there are any signs of infection, like fever chills or increased mucus production.
Are there any other red flags that should prompt a call? Maybe things that seem unrelated to breathing problems.
Unexplained weight changes, persistent fatigue, headaches, dizziness, even cognitive changes like confusion or forgetfulness.
Wow.
Those are all worth mentioning to the doctor. COPD can affect the whole body, remember.
Wow. That's a lot to keep in mind.
It is.
It's clear that communication and vigilance are key. Now, what about those scary emergency situations? What are the warning signs that someone with COPD needs immediate medical attention?
Sudden or severe difficulty breathing is a major red flag. It could signal a pneumothorax, a pulmonary embolism, or a severe COPD exacerbation. Any sudden worsening of breathing problems is a reason to call 911.
So anytime they feel like they can't catch their breath,
absolutely,
it's time to get help fast.
Other emergency situations include high fever, chest pain, any cognitive changes like confusion or restlessness, slurred speech.
Those are all serious signs.
They are.
So it's essential for patients and their families to know when to call for help and not hesitate to seek immediate medical attention.
Exactly. Time is of the essence in these situations.
We've covered so much ground today.
We have.
From everyday management strategies to those critical red flags that require urgent action. It's amazing how much we can do.
It is.
To help our patients navigate the challenges of COPD.
It's a team effort, for sure. And with the right knowledge and tools. We can empower our patients to live full and meaningful lives. Even with this chronic condition.
Well said. Welcome back to Medic Talk. We spent the last 2 segments really getting into the nuts and bolts of COPD. The types, the causes, how to diagnose it, and all those management strategies. But now I want to talk about something just as important. The human side of this disease.
Absolutely.
COPD isn't just about lungs and medication.
It's not.
It's about people living with a chronic, often progressive condition that affects their whole lives.
It does.
We can't forget that.
We can't.
I imagine getting a COPD diagnosis can be really scary. And overwhelming.
It is.
How do patients typically react?
You're right. It's a huge adjustment.
Yeah.
Many patients feel a wave of emotions, fear, anxiety, frustration. It's normal.
Yeah.
They're facing a disease that affects their breathing.
Right.
Which is such a basic human need.
What are some of the emotional challenges they face? I can only imagine the fear that comes with shortness of breath, that feeling of not being able to get enough air.
Right.
And then there's the whole social stigma around smoking.
Yes.
Which is often linked to COPD.
Unfortunately.
That stigma is a huge problem.
It is.
Patients may feel judged or blamed for their condition,
right,
making them hesitant to open up or seek help. We need to create a space where they feel safe and supported.
We do.
No matter what.
Absolutely.
So as future healthcare providers, how can we best support the emotional well-being of our COPD patients?
Well, first and foremost,
okay,
we need to be good listeners.
Yeah.
Let's create a safe, non-judgmental environment where patients feel comfortable expressing their fears and concerns.
What are some practical things we can do?
Sometimes just feeling heard and understood can make a world of difference.
It's about validating their experience, not dismissing it.
Absolutely.
And what about connecting them with others who are going through the same thing?
Support groups are fantastic. Yeah. They offer a sense of community and shared experience, which can be so powerful.
Yeah.
Patients can learn from each other, share coping strategies, and realize they're not alone in this journey.
It's about building that network of support.
Yes.
Knowing there are others out there who truly understand.
Exactly.
Now, what about professional help?
Okay.
When is it appropriate to refer a patient for counseling or therapy?
It's a good idea if they're struggling with anxiety, depression, or other mental health concerns.
Right.
Therapists can help them develop coping mechanisms, work through difficult emotions, and find healthy ways to manage stress.
So it's about giving them the tools to navigate the emotional roller coaster of living with COPD. And remember, seeking help is a sign of strength, not weakness.
Absolutely.
It shows they're taking charge of their well-being.
It does.
Now, beyond professional support, are there things patients can do on their own to cultivate a more positive outlook?
You got it.
I believe there are.
They may not be able to magically cure their COPD, but they can take charge of their health by making healthy choices.
Like what?
Like quitting smoking. Avoiding triggers, sticking to their medication regimen, eating a balanced diet, and staying active.
Absolutely. It's all about focusing on what they can control.
Yes.
Right?
Yes.
Not dwelling on what they can't change.
Exactly.
It's about empowering them to be active participants in their own care, not passive recipients.
Right.
And celebrating those small wins along the way.
Absolutely.
Can be really motivating.
Did they manage to walk a little farther today?
Yeah.
Did they resist that urge to light up a cigarette?
Right.
Those are huge victories worth celebrating.
Exactly.
Every step in the right direction is a win.
It's about shifting the focus from limitations to possibilities. Finding those moments of joy and gratitude amidst the challenges.
Exactly. Living with COPD doesn't mean life is over.
Right.
It means adapting, adjusting, and finding new ways to thrive.
Right.
It's about focusing on what brings them joy, spending time with loved ones, pursuing hobbies, or simply appreciating the beauty around them.
It's about finding purpose and meaning in life.
Yes.
Even when things are tough.
It is.
And that's a powerful message for all of us, not just those living with COPD.
Couldn't have said it better myself.
We've covered a lot of ground today, haven't we?
We have.
From the intricacies of diagnosis to the complexities of treatment and the often overlooked emotional aspects of living with COPD.
It's been an incredible journey.
It has. We've really explored this disease from every angle.
We have.
Which will make us better prepared to care for our future patients.
Yeah.
What are your final thoughts for our listeners today?
COPD is a challenging disease.
It is.
But with the right knowledge, tools, and support, our patients can live full and meaningful lives. As healthcare providers, let's remember to treat the whole person, not just the disease.
Exactly.
Let's be their advocates, their educators, and their partners in navigating this journey.
Beautifully said. And to our listeners,
yes,
remember that knowledge is power.
It is.
Keep learning,
Absolutely.
Keep asking questions. And keep advocating for yourselves and your loved ones.
Yes.
Thanks for joining us on this deep dive into COPD. We'll see you next time on Medic Talk.
Sounds good.
Where we'll continue to explore the fascinating world of medicine.
Okay.
One episode at a time.